Hello, everybody. Myself, Dr. Neetu Modgil. I'm working in KIMS Hospital, Secunderabad. Today, the topic of discussion is obstructive sleep apnea. So, obstructive sleep apnea has become one of the major topics of discussion. There is a obstructive sleep apnea day. People are celebrating. We have a day in our 18th of March. But then the concern is why it is becoming a kind of hot topic, we can say, for discussion. Are we really bothered about snoring? Because if when I was not an MBBS student, if I am a lay person and I'm a layman who is talking about snoring, then who comes in my mind from the Vedas and Ramayana is a Kumbhakarna, a big heavy male patient with big tummy sleeping with making sounds. And that's a funny thing. It's usually we used to make fun of people who snore, and we used to definitely compare them with Kumbhakarna. And we have this notion in our mind that anybody adult male with heavy tummy and heavy weight, obese patient, when they sleep at night time with thick or stout neck, they must be making sound at night time, funny sounds at night time. But now it has crossed that stage of being funny. It's in a serious stage. Like, we really need to take this seriously into consideration that snoring is one of the silent killers. It is third most important cause for divorce in America. Maybe the scenario is same in India, we don't know about it. It is one of the major causes single-handedly, without the help of nicotine, without the help of cholesterol. Sleep apnea is able to damage our heart and brain. Now let's understand the depth of the sleep apnea or obstructive sleep apnea. See, the session is never to scare you all, it is always to make you aware. We really need to come out of our slumbers, from our comfort zone, to fight these diseases, which were not diseases earlier, but now it is. With the advent of new diagnostic aids, new surgeries, and new techniques like CPAP and BiPAP, we are able to treat sleep apnea effectively. So now we need to understand what exactly is the sleep apnea. First of all, it's a rough idea that 49% of the children, 40% of the adults are suffering in one way or the other with obstruction of the airway during sleep. It can be either resistance, not having the stage of apnea. But then in higher stages, it goes to the stage of obstructive sleep apnea. The name itself explains the disease. I do not have to define it, but just let's have 1 minute on understanding obstructive sleep apnea. Obstructive means there is an obstruction, कहीं पे रुकाव है. एयर जो हम नाक से लेते हैं वो कहीं ना कहीं हमारे लंग्स में नहीं पहुंच रही है. The purpose of sleep or the purpose of breathe is to take a good amount of healthy oxygen to the lungs so that it can have exchange of carbon dioxide and oxygen filled blood will go and repair and help in the growth of our body and repair the system which has been damaged during the daytime for one reason or the other, a wear and tear damage, emotional damage. It's just how the life goes on, how a human body goes on. And most important thing is air. Definitely, we know that air is one of the important things. We have understood the depth, the oxygen, we have realized the importance of oxygen in Corona. Thanks to COVID, it has made us realize that how important is oxygen for us. So that's how, if we understand the importance of oxygen, we will be easily able to understand obstructive sleep apnea. So once we breathe, when we start breathing, usually during the night time, there is an obstruction of the airway. This is called obstructive. Sleep means when patient is sleeping, obviously. Apnea is related to the breath, inspiration, expiration. So when it is the breath is stopping due to some obstruction, we will talk about what are the causes of obstruction later. Due to some obstruction in the airway, it leads to apnea. So the patients with obstructive sleep apnea, they usually they wake up at night time gasping for the air. They feel like the doom sensation that they are going to die, or they are going to they are suffering with some kind of suffocation to the extent that they will die. And they really get up at night gasping for the air. And it happens sometimes multiple times at night time, depending on the depending on the severity of it. And then the patients with obstructive sleep apnea, what exactly is happening? Why the obstructive sleep apnea is like happening? Now we have to understand this fact that we have to breathe from the nose. When there is an obstruction in the upper airway or the lower airway, to close it. So there is the airway is divided into upper airway and the lower airway. So first let's understand the upper airway, which is a gate or a window for the lower airway. So this is our upper airway in which we have nose. We have this is the nose of the patient, and then we go back. This is the nasopharynx. This is the area where there are adenoids, and then there is the oropharynx down, which is just behind this lips area, in the mouth area, and then from here it goes into the larynx, and from there it goes into the lungs. So most of the time, what happens in obstructive sleep apnea, patients, what is exactly happening with obstructive sleep apnea? When the patient is dying, the oxygen level goes down. This particular message that oxygen level is going down goes to the brain multiple times. So when this message goes to the brain, it wakes up the body or it increases the blood pressure. There is hormonal changes, increase in the steroid level, increase in the stress hormones at night time. And this process of decreased oxygen, sending a message to the brain, patient waking up, increasing blood pressure, increasing steroid level is happening multiple times for months and years in human patients having sleep apnea. Now, what will happen at night time? We are supposed to have a low blood pressure for the repair of our body. We are supposed to have good oxygen level for the repair of our body. But now this particular patient is not having the good amount of oxygen. And apart from that, rather than having patient is having low oxygen, plus patient is also having high blood pressure. So this high blood pressure is causing damage to the minute blood vessels in the brain and the heart. And after a few years, the patient will be suffering with heart and brain. Like patient can have stroke, patient can have heart diseases, patient can have congestive heart failure, patient can have heart attack, patient can have pulmonary hypertension, patient can have uncontrolled diabetes, uncontrolled hypertension. Patient will be on 3 to 4 drugs for the control of hypertension, but there is no control of hypertension. So this is how the decreased oxygen level in sleep apnea can damage our body. And it does not need the help of anything. इसे cholesterol नहीं चाहिए, इसे nicotine नहीं चाहिए. Single-handedly, it can damage your body. This is how it is happening at a higher level. Now, patient is not breathing from the nose, patient is breathing from the mouth. So we have to understand what are the side effects of mouth breathing. So the patients who breathe from mouth, they usually have recurrent sore throats. They get up in the morning coughing and they have irritation in the throat. They have dental caries. The air which is going inside the lungs is not filtered by the nose. It's not humidified by the nose. It's not of the body temperature. It is cold air or hot air. It will damage the lungs with time. So these weak lungs are prone to infections and they are definitely prone to develop asthma, pneumonia, bronchitis later on. So that's how mouth breathing, which we may take as a fun, that this person sleeps with mouth open, but this is not actually fun. So mouth breathing can damage our body to a certain level. And then definitely the oxygen level which is going down is damaging our kidney, heart and brain and lungs, the vital structures of our body. The patients with recurrent voice changes also, they do have mouth breathing habit. Now, this problem, which I just told you, that incidence is 40% in children, 49% in adults. Now, this is a disease which there is no bar. Like, for example, diabetes, we understand, yes, we have pediatric diabetes, like it happens after a certain age, type 1 diabetes. But then there are some diseases like hypertension, high cholesterol, they come after a certain age. But this particular sleep apnea is not sparing any age. It's not sparing the thin-built people. It's not sparing. It's like anybody can suffer with sleep apnea. Please do not have this myth that the person should be male, person should be obese. एनी थिन बिल्ड पेशेंट, छोटा बच्चा 1-2 साल के बच्चे से लेके 80 इयर्स तक स्लीप एपनिया किसी भी डेमोग्राफिक प्रोफाइल में हो सकता है. Anybody can be having sleep apnea. Now we have to understand that I have told you this is how it is damaging our body. But the important factor is to understand that how can we diagnose at home that the baby or the adult is having sleep apnea, is having snoring, is having upper airway resistance. आप उसे कुछ भी तरह से बोल सकते हैं. Now in a pediatric age group, they usually will be like, they think that the mouth opening is never always the wide open mouth. It's always like few millimeters gap between the upper lip and the lower lip. That is mouth breathing. So we have to understand this. We have to observe our kids. If they're sleeping with few millimeter of gap between the lips, it means they are mouth breathing at night time. So when kids are mouth breathing at night time, they're sleeping properly, they're not getting up at night. So what will happen after few years or few months, they will start having trouble with concentration. The teachers will complain that they do not concentrate at class. They have less reaction time. Like any small thing, they will start reacting very fast. They will be getting angry very fast. They have problem adjusting with the peer group. They will be hyperactive kids. And with time, when they keep on breathing from mouth, the facial changes, the cosmetic facial changes start coming. There will be crowding of the teeth. The nose will be small, pinched nose. There will be a little gap increase between these two medial areas of the eyes. The face look dull. And with time, the patient, when he or she is not having oxygen properly at night time, it impacts the cognitive development, the emotional development irreversibly. So these kids cannot take competitions, cannot take emotional imbalance or emotional setback easily. And that time it is irreversible. The damage has already happened. So we are just doing these sessions to make our public aware about it. At present, I talked about the pediatric age group. Let's talk about what will happen in an adult. If an adult is having snoring or obstructive sleep apnea or upper airway resistance at night time, due to which she is making sound at night time, or maybe the person is sleeping alone and nobody knows that he or she makes sound at night time, then how to diagnose? Then what will happen? Patient will get up in the morning with dry mouth. They will feel like clearing the throat. They keep on doing like this. There may be cough when they get up in the morning. They will not be fresh. They will feel like sleeping more. And this will not only be confined to the morning period. During daytime also, they will feel sleepiness. This is called excessive daytime sleepiness. This patient will be getting angry more. They will have less reaction time, like they don't give time to react to anything. They usually get angry very fast. They are emotionally weak. That is something which may be a personality, but if you are seeing these changes in any person, just like from last few days or months, maybe that person is having sleep apnea or not able to sleep at night time. Insomnia is entirely different from sleep apnea. Insomnia means that patient is not able to fall asleep. That is mostly psychiatric and neurological, but we are talking about sleep apnea. So that is beyond the realms of our discussion. Let's confine our topic to sleep apnea. So now if any of your family member is complaining about that you make sound at night time, don't tell that you better sleep in another room. Please come to the hospital and get diagnosed. Because we cannot treat sleep apnea until unless we are not able to diagnose that what is the reason behind your sleep apnea, what is the reason behind your snoring, what is the reason behind the obstruction of the airway. Is the obstruction happening at the central level? Is the obstruction happening at the peripheral level? Like it is happening at the upper airway or lower airway, laryngeal level? We have to find out what is the reason behind it. What is the reason behind this? Is only obstruction? Because most of the time it is the neuromuscular bundle, like neuromuscular disease. the nerves supplying the muscles. There will be some changes in that particular pathway leading to collapse of the muscles responsible for taking the air inside the lungs from the nose. So this particular system is complex, and we need multidisciplinary approach for that. Means we need various specialties to diagnose first the cause behind the sleep apnea. Second, what is the stage of sleep apnea? Because it's not only sleep apnea. There will be stages. It's not like malaria, dengue, diagnose, treat, and done. It's entirely a different thing. It is something we have to understand that this particular sleep apnea is in this particular stage, stage 1, stage 2, stage 3, mild, moderate, severe, in whatever language you understand. So there are various levels of sleep apnea and various levels of obstruction, various causes behind it. For this, we need multidisciplinary approach. So when patient come to us, we first of all do the general examination, oral examination, nasal examination, and then we need some specific test to diagnose sleep apnea. And that is where developing countries are lagging behind. Because patients are like, we are snoring only. Why should we spend money on CT scan? Why should we spend money on endoscopy? Why should we spend money on sleep study? No, it's okay. Snoring, say, I'm not having any problem. My wife is having problem, or my husband is having problem. They can sleep in another room. Why should I spend 20,000, 25,000 rupees, 50,000 rupees on diagnosing this thing? Doctor can write a medicine just by understanding that I have this problem. No. We have to understand, we have to first of all find out the cause behind it. We have to find out the diagnosis, what is exactly what is causing the sleep apnea. Until unless we are not able to understand what is causing the sleep apnea, it is not possible to treat you. So now what are the different ways to diagnose it? First, we usually send the patient for sleep apnea study. We call it sleep study. There are different levels in that. Level 1, level 3 is there. In this, we diagnose that there is a apnea-hypopnea index is there. There are different levels of this, like 5 to 15 is mild, 15 to 30 is moderate, more than 30 is severe. Like that, there are different classifications. And depending on the mild, moderate, and severe sleep apnea, we have different levels of treatment for that. So now we have understood with the sleep study that this patient is having either mild, moderate, or severe type of sleep apnea. Now we have to find out what is exactly causing the sleep apnea. Where is the obstruction line? So for that, sometimes we need CT scan of the nose and paranasal sinuses. But the most effective investigation for that is drug-induced sleep endoscopy. So in this, the patient is given a drug to go into a deep sleep. A flexible endoscope is put from the nose, and from there we start putting it till the laryngeal level. And we see there are different levels. There are 4 levels of obstruction, which you may not understand, but there are 4 levels of obstruction. A patient can have different levels of obstruction at a time. A patient can have 3 levels. 3 levels are involved in the obstruction. 2 levels are involved in the obstruction. It may be nose, it may be nasopharynx, it may be oropharynx, it can be base of the tongue, it can be epiglottis. And that also, there are different criteria, like it is anterior, posterior, it is lateral, it is circumferential. What all areas are involved, and how can we treat this patient? Now we have done the sleep study. We have seen the patient with drug-induced sleep endoscopy and CT scan of the nose and parasinuses if required. These are enough for us to understand that what are the areas of obstruction. And now there are some blood tests also, like HbA1c, lipid profile, erythropoietin levels, CRP levels. So they just give us an idea that how much damage has happened to the, like I told you that blood vessels, when they have high blood pressure, it can damage our kidney, lungs, heart, brain. So these are the parameters which can give us an idea that how much damage has already happened and what is the alarm right now. Now, after getting all these things done, we do a multidisciplinary approach. Sometimes patients just only need some nasal sprays, exercise, routine, a good routine to sleep and get up in the morning, yoga, and maybe they will be fine. Some patients are in severe stages. They need quick actions. Then we may need to approach multidisciplinary in the sense like patient has to use CPAP and BiPAP. And maybe along with CPAP and BiPAP, patient also need, with CPAP and BiPAP, patient also needs surgery to clear the obstruction. For example, in pediatric age group, they usually have adenoids and tonsils. Parents, they are so scared to take the baby to the operation theater for adenoids and tonsils that once it has caused a cosmetic and cognitive development defect irreversibly, then they feel the need for operation. So it has to be done at certain time, and that is customized. That is every patient is different, like a fingerprint. So we cannot say that each kid should be operated at 5 years of age or 4 years of age. It is always different for different age group. For every patient, it is different. So they have to go and visit their pediatrician, their ENT doctor to understand that what is the grade of blockage and what is the treatment when they go for treatment, when the medical treatment is available. So take home message from this session is obstructive sleep apnea is not something to make fun of. We should take active actions to take our people, my friend, your family member, to the hospital to diagnose the cause, diagnose the obstruction leading to the sleep apnea. With the advent of new findings, new techniques, diagnostic techniques, and new medicines as well as surgical approaches, it is easy to treat the patients. There are many advancements in surgeries, like for the nasal tissue, for the palate, for the base of the tongue, for the epiglottis, which you may not understand in a short session like this. But then not only surgeries, then CPAP, BiPAP, there are many approaches for that. Right. So many of the patients, they think that some Ayurvedic or homeopathic medicine can treat snoring. Please, better to visit your specialist for snoring to understand that how we can treat the patient. So I will really appreciate if somebody can ask me questions. Otherwise, I have given the ample information in layman terms and language, and I hope it will help you. And I really wish that it will.